Hello everyone. Today in this video, I will be discussing on the prevalence and clinical picture of suicidal behaviors. Look at the picture. You must be knowing him. Before he became one of the leading musicians of India, a huge loss in a business deal led Kailash Kher to try drowning his misery. He tried committing suicide by jumping into the Ganges. The risk of suicide, intentionally taking one's own life, is a significant factor in all types of depression. Virtually all psychological disorders increase the risk of suicidal behavior. Indeed, approximately 90 to 95% of those who die by suicide have a history of at least one psychological disorder. However, depression is the disorder that is most commonly linked with suicidal behavior. Moreover, individuals with two or more mental disorders are at even greater risk than those with one. Reported by World Health Organization, suicide currently is the 15th leading cause of death in the world, accounting for 1.4% of all deaths. Now, the question arises, who attempts and dies by suicide? Although researchers are still working to understand why people engage in suicidal behavior, there are no clear and consistent findings regarding which segment of the population are at high risk. In virtually every country around the world in which a suicidal behavior has been examined, women are significantly more likely than men to think about suicide and to make non lethal suicide attempts. But according to WHO, men are 4 times more likely than women to die by suicide. This difference is likelihood of suicide death is explained in a large part by the fact that men tend to use more lethal means in their suicide attempts than do women. One remarkable trend has been increased risk among adolescents and young adults, which emerged during the past several decades. Why has there been such a surge in suicidal attempts and completed suicides in adolescents? One obvious reason is that this is a period during which depression, anxiety, alcohol, and drug use and conduct disorders problems also show increasing prevalence, and these are all factors associated with increased risk for suicide. Many college students also seem very vulnerable to the development of suicidal ideation and plan. The combined stressors of academic demands, social interaction problems, and career choices, perhaps interacting with challenges to their basic values, evidently make it impossible for some students to continue making the adjustment their life situation demand. The most widely studied risk factor for suicidal behaviors are the presence of different psychological disorder. As noted earlier, the presence of virtually all disorders increases the risk of subsequent suicidal behavior, and most people who die by suicide have a prior mental disorder. Now let's understand how and why would so many different disorders be associated with suicide. Recent research has revealed that different disorders are associated with different parts of the pathway to suicide. For instance, as you might expect, depression is the disorder most strongly predictive of which people develop suicidal thoughts. However, it does not predict which people with suicidal thoughts go on to act on them and make suicide attempts. Instead, it is disorder characterized by agitation and aggression, impulsiveness that predicts acting on one's suicidal thoughts, such as post traumatic stress disorder, bipolar disorder, conduct disorder, and intermittent explosive disorder that predict this transition. Now, let's understand the warning signs for suicide. When someone threatening to hurt or kill themselves, someone looking for ways to kill themselves, seeking access to pills, weapons, or other means, someone talking or writing about death, dying, or suicide. We can observe certain behaviors such as hopelessness, rage, Anger, seeking revenge, acting reckless, or engaging in risky activities, seemingly without thinking, feeling trapped like there's no way out. Increasing alcohol or drug use, withdrawing from friends, family, or society, anxiety, agitation, unable to sleep, or sleeping all the time, dramatic changes in mood, no reason for living, no sense of purpose in life. Now, let's talk about some biological factors related to suicidal ideation. There is a strong evidence that suicide sometimes runs in families and that genetic factors may play a role in the risk for suicide.